Okay, so let me get started now. I'm Randy Kearns. I'm your professor over here at the University of New Orleans, working again with your distinguished professor there, Dr. Uhu. And I actually today and tomorrow I will be in Dallas, Texas. I have a meeting over here, and so I'll be coming into your classroom from Dallas instead of New Orleans. So let's go ahead and talk about our topic for today. We want to talk about what we know about the healthcare environment. Again, as I mentioned before, I obviously know far less about the environment of healthcare in China than I do here in America. But I do want to tell you about some of the characteristics of the healthcare system here in the American model of healthcare. The five big things that I want to talk about today: Americans have access to great healthcare, but we don't always choose wisely. And I will go through some of the details of choices that we make. What are things that are inherent, that are built into the way the healthcare system functions, or some would say doesn't function very well here in the American model of healthcare. Americans have expensive healthcare. We spend a great deal of money on our healthcare, and we don't always have a lot to show for it. We will talk about some of those things shortly. There are three types of what's considered traditional models of healthcare: the holistic model, the wellness model, and the medical model. And I'll cover each of those this afternoon. So the holistic model is really about bringing in the whole patient. What are all of the things that influence someone's health? The environment that we live in, the air that we breathe, the water that we drink. Being sure that I saw a piece of information recently that was, suffice to say, quite disturbing. But the world's population is about 7.7 million people, and only about half of the world's population has access to clean water to drink. Comparatively speaking, more people in the world have access to a cell phone than they do clean drinking water. I'm not sure what that says about us as a world population, but from a holistic model, understanding the influence that the environment has on our health, understanding the things that we do to make ourselves either support our health or ignore our health. Again, those are components of the holistic model. The wellness model is more about understanding the role that we play in keeping our bodies healthy. Being sure that we get sufficient activity, being sure that we eat nutritious meals. The wellness model is really about focusing on the body, whereas the holistic model looks more at the environment. And then the medical model is what most Americans default to. Sadly, though, the medical model is the most expensive approach. We, in a certain way of speaking, we refer to it as a take a pill mentality, meaning, sometimes we ignore our health until it's too late, and then we go to the doctor or to the hospital and expect them to fix it. Well, they can, and typically they do. But it can be expensive, and again, that type of reactive approach instead of a proactive approach can really be costly, and I'll quantify that later. Health it continues to be an evolving term in terms of how do we understand what health means. we've not always had a clear understanding of causal effect. What are things that we do in our life that impact our health, either short-term or long-term? Again, the three leading approaches, the medical model, the holistic model, and the wellness model, all give us different insights into ways that we can either be healthy, stay healthy, or remain healthy. Again, the medical model is a more expensive approach to that, but our definition of health has changed in a pretty dramatic way as the science has changed regarding our ability in how we're taking care of patients. So let's talk specifically about the medical model just a minute. This is the dominant way that we provide healthcare in America. It's also the most extreme form. It views the body as a machine that can be fixed when it's broken. It specifically emphasizes treating diseases, but it doesn't really take into effect and certainly understand the aspects of social problems, mental health, and there's not a lot of emphasis on prevention. In fact, the challenge with prevention is a long-term investment. The American model of thinking for a lot of things, whether it's business and industry or our own personal health, is almost quarter to quarter. In other words, over every 3 months, we stop and reevaluate and see where we are. And that's okay if you're seeing that in the context of the long-term investment. We're typically not looking long-term. We're typically only looking ahead for the next several months. And because we do, we tend to dismiss things that may have a cumulative effect. Again, with the medical model, the primary concern is diagnosing a disease and treating a disease. Again, a very expensive way to provide healthcare. The holistic model is really that the entirety. It's not just an absence of disease, but it's physical well-being, it's social well-being, and it's mental well-being. It's a much broader perspective than the medical model. Certainly the medical model has a play in the holistic model, but the holistic model is really about understanding how our place in society helps us to feel good about ourselves, but also to be supportive. And again, it identifies as a public health issue. What are things that create barriers for us to be able to achieve a certain level of wellness that we're trying to accomplish? And speaking of wellness, it's really about living together over time. It's the wellness model focuses on environment. The wellness model focuses on things that we do to help keep ourselves healthy. How many activities do we participate in? How much activity do we do? Being active, keeping healthy, staying fit, are all essential parts of the wellness model. But other aspects of the wellness model also includes cleanliness, the importance of hygiene, the importance of having clean air to breathe, clean water to drink, and being sure that we have substantial and sufficient amounts of a variety of food, particularly fruits and vegetables, things that can certainly promote our health and help contribute to our health. Within these three definitions, though, let's kind of take a look at the American model of healthcare. Again, so much of so much of what we do in the American model of anything is built around capitalism. And just understand that capitalism has certainly it has its advantages. It's helped fuel a financial growth here that's fairly substantial. But we try to use capitalism as a solution for a lot of things that we do. And capitalism in healthcare doesn't always work well. I refer to something called the Walmart model. I think I've got some information coming up on that in just a minute, but when we think of capitalism, Walmart's a great example. I go in, there's 3 products I don't want to buy. I buy them, I leave. Walmart has the money that I gave them. I have the products that I wanted. It doesn't exactly work that way in healthcare. And, how much do we continue to spend on healthcare continues to be a growing and alarming concern. As a percentage of GDP, healthcare has risen in the United States from 4.1%, 4.4% to 20.1. Now, the 20.1% is a reflection of the pandemic. I will tell you the more recent numbers were back down into the high 17s, low 18%. It's still, and I'll show you in context in just a minute what that really means. At the same time, the US is identified as the 45th healthiest country on the planet. If we spend more money than everybody else on the planet for healthcare, you would think we could buy better healthcare. We would certainly be healthier as a population, and the reality is no. And there's some contributing factors to that, and I'll talk about those shortly. Sometimes we blame it on the physicians, sometimes we blame it on the hospitals. The reality is a lot of this gets back to us, the patient, and choices that we make. So again, just to borrow from your economics class, supply and demand has its place in healthcare as well. I'll bring this back up in just a minute. The Walmart model again tells us that I walk into a Walmart, everything that I decide that I want to buy, that I can afford to purchase, I take to the checkout counter and I purchase. With healthcare, it's different. With healthcare, at the moment that I need it, I don't care what it costs, and I typically am going to get what I need regardless of my ability to pay. And so it creates these real challenges of if I'm managing a hospital, if I'm managing in the healthcare world, how do I pay for the things that I've just done? We've got to create capacity, and we've got to look at throughput management. There are a lot of, again, traditional business and management skills that we use in healthcare for both effectiveness and efficiency. And we're constantly looking at that line of where we are effective or where we are efficient. But there are times that we cross over that line. And when I say we cross over that line, I'm talking about getting into areas that are dangerous. And so, the advantage to capitalism is you can be operationally very effective in being able to do whatever you're doing. But the disadvantage is sometimes it can push you to levels that are not sustainable and sometimes not safe. So let's talk about the American model of healthcare just a minute. Global wealth in 2022, the United States economy is the largest economy in the world at $25 trillion. China is a close second at $18 trillion. Just understand the rest of the world. Japan at 4.3 trillion, Germany at 4.03, just under 4.1 trillion, India almost 3.5 trillion. Here in the United States, we spent $4.3 trillion for healthcare. That's more than the entire economy of every other country in the world other than China or here in the US. You know, it is disturbing how much money we spend on healthcare. It also reminds you just that money isn't everything, because we spend so much money on healthcare and yet we're not a healthy population. There are countries that spend far less on a per capita basis and yet have a much more healthy population. You know, these are just ways to put it into context, but 24 hours a day, 365 days a year, 8,760 hours in a year means we spend about $490 million an hour in the United States for healthcare, or about 8.17 million per minute. In 2021, we spent just under 13,000 for every man, woman, and child for healthcare, which again is a great deal of money. You know, national health expenditures as a percentage of GDP. Again, this is only tracked through 2020, but it shows that a substantial uptick during the pandemic. I will tell you that number has come back down as the pandemic is, for the most part, behind us here in the United States. I mean, people are still getting sick with COVID. Occasionally people die with a condition associated with COVID. But generally speaking, the pandemic is at least here in the United States is over. And some of the things that we ramped up to do during the pandemic have begun to unwind and wind down. But, you know, when is the next pandemic going to occur? The world is a much smaller place than it's ever been. And so when there's a disease outbreak in one part of the world, it more than likely will find its way to other parts of the world very quickly. And so global pandemics will be far more of a thing of our future than they have been in our recent past. Again, if we look at how our healthcare system performance and how our healthcare system spending, we don't have a high performance standard. Most of our European friends, and I'll add Canada, Australia, and New Zealand into that, but those particular countries typically have high performance standards and a lower cost. Whereas here in the United States, we have a much higher cost and in many cases don't have as high performance a standard. Again, there are things that we can attribute to that. We'll talk about more of that in a minute, but this again gives you a percentage of GDP or total expenditure on a per person basis reported in US dollars compared to other countries. And again, it reminds you how much we spend on healthcare. You know, actually, let me move on to so root cause analysis. If we're trying to get to what the root cause is of why we're spending as much as we are, on one hand, we don't spend a lot of money on preventative care. Most countries spend a lot of money on vaccines, wellness, things that prevent disease, things that help people avoid getting sick. Again, because we have more of a medical model approach, we tend to take some of those things for granted until we're sick. And then when we're sick, we expect somebody to spend a lot of money to make us well again. Administrative cost. On on a per capita basis here in the United States is much higher than it is much of the rest of the world. The one place that we don't spend as much money on today is long-term care. We have done a good job of evolving the medical model into more of a home health type approach. I think in the aftermath of the pandemic, we'll see a lot more telehealth. And then that, I think, ultimately could drive down some of our costs associated with healthcare. I don't know that it'll ever drive it down as much as it'll at least help abate some of the growth. Again, as a percentage of national expenditure, these are projections compared to reality. But it does give you an idea of just how much a percentage of GDP our spending in healthcare has continued to climb. Now, the only if there's any consolation in all of this, it is how the dollars wind up staying within a given economy and continue to be spent and reinvested in that economy. And we are far more likely to do that with healthcare than we are some products that there are a lot of things that we import to the United States. Those consumables that we purchase, when we purchase them, in many cases, we're buying them from other countries, which does not contribute to our GDP. So the fact that a lot of healthcare is local actually helps the local economy. Again, it's a trade-off because this is a substantial amount of money that's being spent, but it is being spent in the local economy, and so it does help promote development and growth in a local economy. You know, there are really three ways to manage healthcare cost as a country. Number one is a monopoly. So this gets back to your basic economic theory. Supply and demand. If as demand goes up, either supply will go up to match it, or price will go up. But at some point, demand will begin to taper off, but it'll taper off at that point of equilibrium only based on either supply has risen to meet the demand, or price has risen in a way that what the price point has done, it has been done to slow down the demand. Now, some countries, England as an example, has chosen they own all of the healthcare. That's a monopoly. And when you control all of the supply, such as you own all of the hospitals, you're a monopoly. It's a lot easier to control the price associated with that. In some countries like Canada, they provide health insurance for every person in the country. That's a monopsony where they control and they manage all of the demand. And so from a capitalist standpoint, supply and demand are key economic drivers of anything that we do in a capitalistic society. If you can, certainly controlling all of one or the other is not capitalism, but if we let the markets decide, and currently that's what we're doing in the American model of healthcare, we leave it to the market to decide both the supply side and the demand side. From the supply side, governments on various levels do own and operate some of the healthcare. On the demand side, governments do supply and provide some of the insurance, but they don't control all of it. Until you can control all of the supply side or the demand side, that price point will continue to be elusive. It'll continue to be out there beyond your control. And that is the challenge that we're faced with in the American model of healthcare. So it is unique. Nobody else operates healthcare the way we do. And that's typically a good thing for the rest of the world. We don't have a lot of overall goals. There's a central agency that coordinates things, but it really doesn't govern things. That's the U.S. Department of Health and Human Services. There's a lot of different layers of access. Employers are not mandated to offer insurance. Now, there's some variation in that. The Affordable Care Act did require employers of 100 employees or more to provide insurance. But there's, again, the challenge with that is there are a substantial number of small businesses in America. And when you have that many small businesses that don't have to provide insurance, you're still left with a significant number of people who don't have insurance. And the ability for users to select providers based on quality, we don't have good quality metrics that we routinely publish so that people, users, potential patients can identify where the best quality is. And then we're always making changes. And so as you continue to change things, particularly in healthcare, it creates a great deal of uncertainty. And when you have uncertainty, it's very difficult for organizations like insurance companies to figure out how to price some of their products. And so, they certainly don't want to lose money, so they're going to price them probably higher than their price point needs to be, but it again protects the company. So why is the American model of healthcare so challenged, so difficult to deal with or understand? We have a lot of conflicting views. Everything that we do in the United States, in many cases, we think back to, well, is it guaranteed in the Constitution? That ultimate set of laws that govern how we do things here in America. And no American is guaranteed the right of healthcare. And so without that guaranteed right of healthcare, you're left to the whims of, does it make more sense for the government to provide more healthcare, or does it make more sense for the government to provide less healthcare and put that back on the patient's responsibility? Anyway, it's that individualism versus the community. And then how much of this goes to self-determination? If I want to decide for me who I go to see as a physician, how does that work? What does that mean? There is a lot of distrust of the government. We are a candid and open society. If we don't like what our government is doing, it's very easy for us to make significant changes every 2 years, and a change in leadership in terms of the president every 4 years. And so if we don't either trust or like what's going on in government, then we can vote them out. Well, certainly there are advantages to that. The disadvantage to that, though, is it does create this constant evolution of change that's going on in healthcare, primarily as we have two large political parties that predominantly control most of the politics in our country. And it's safe to say their political philosophy as it relates to healthcare, they don't converge a lot. There's a lot of divergence. There's a lot of different points of view. And then how much do you believe in the private sector versus how much do you understand what type of profit motives some organizations have? There is a basic underlying logic to all of what we do in the American model of healthcare. And it really starts out with the people that we serve. It's all of us working together, and a part of that includes how how we serve the needs of the community that we serve. And so that kind of begs the question, what do we know about the people we serve? We need to know more about the population that we're serving, what the demographics are, what the community looks like. Again, America is a country of immigrants. All of our last week, I was in Ireland speaking at a conference in Killarney, and flew into Dublin, stayed in Dublin a couple of days. My family originally came from Ireland, now about 250 years ago, but it does remind you once again that there are very few people who live in America today whose family didn't come from somewhere else. And so that vast range of demographics, societal demographics, really helps our understanding of the world, because many of us are from, at least our families are from other parts of the world. As long as we are open-minded to listen to that, the farther west you go in the United States, the more you have a significant Asian population. The farther east you go, the more likely you have more of a European population. In the south of the southeastern part of the United States, you have a lot of people who came here from Africa, and particularly in the south central part of the United States, we have a lot of people who came here from Central America and South America. So understanding the societal differences, the community needs, the demographic characteristics can really help us target what are things that people need. So what do we know about the people, and then what are key characteristics to help us understand the best way to take care of patients? When we talk about demographic characteristics, age is not just a number. There's also a generational effect that goes with that. It's not just about the difference in the age between someone born in 1965 versus someone born in 1985. It's also, there's a generation gap there in terms of how we see the world, how other people see the world. And so understanding that age is an important characteristic, but age also gives us insight into the beliefs, the long-held and strong-held opinions that people may have of different age groups or different generations. Gender, gender obviously has a substantial effect on how we think about things in the context of how people do what they do, how they work, how they solve problems. Women are typically more deliberate, and they're typically more thoughtful. They're typically better organized. And so understanding the differences in characteristics between men and women, and then other aspects of gender certainly contribute to how we think about things. And then birth and death, what were the conditions at birth? What were things that led up to death? Just understanding the demographics of the population can help us also look for ways to help people have a healthy birth and a long, productive life before death. But these the data associated with these demographics can help us do that. Again, so as we look at the people, trying to understand how we serve the population is essential in terms of trying to be sure that we develop the best type of system and the best type of approach. Here in the United States, we're having an aging population. The largest generation is the baby boomers, and the baby boomers were born between 1945 and 1964. Many of this group are beginning to reach retirement age or have reached retirement age, and we've not done a good job of sustaining the population in a way that allows us to pay for some of the services that we've historically provided each generation in front of us. And so this graphic kind of gives you an idea of how the predominant group has continued to age from start to finish, and then where that's going to put us in terms of distribution of people based on age. You know, America is getting older as a country. The number of people over 60 has grown substantially. Part of that is based on also health and well-being, but it's also based on the fact that the largest segment of our population is an older population. And how do we curb that, or how do we alter that or change that? You know, the only way to do that is to increase birth rates or increase immigration, or both. And again, those, at least one of those ideas has some political ramifications that not everybody is bought into. The older you get, the more you cost. You know, it's as our patient population gets older, the more it costs to provide healthcare for that patient population. You know, and then what population is responsible for the greatest amount of cost? Who's the top spenders in terms of healthcare spending? Again, it's typically the older population and certainly the sicker population. High spenders are older. I don't think there's any unusual thoughts about that. Gender distribution, there's the things that this slide points out more than anything else is it does remind us some of the things that certainly contribute to challenges that we face, either short-term or long-term, as an overall healthy society, whether it's mental health or a disability. Sometimes it's things that we choose to do. Smoking, although our numbers of people who choose to smoke tobacco products is lower than it has been in 50 years. You know, and if I haven't told you lately, probably the most important thing you can do to improve your long-term health is to not smoke cigarettes. If you've started smoking, don't smoke or stop. And if you haven't started, don't start. Nothing will lower your life expectancy by about 10 years more than smoking cigarettes. And while vaping is marginally safer than smoking cigarettes, neither of them are safe ways to, there's no safe way to put nicotine into your body, at least as we understand it right now. Obesity and being overweight is a problem in America. We eat a lot of calories without a lot of nutrition. And when you eat a lot of calories without a lot of nutrition, it's very easy for your weight to get away from you and to wind up being either overweight or in some cases obese. Infant mortality rate here is much higher than it should be. Again, it's a reflection of a lack of support, particularly in rural communities. And then children in need continue to be a targeted population for us to continue to provide certain essential benefits to and services to. Gender pay gap, some of the areas with the largest gender pay gap includes Wyoming and Louisiana. You know, gender pay gap is really about recognizing the fact that a woman doing the same job as a man should be paid the same amount as a man to do the same job. It's not legal in the United States for a man to be paid more than a woman if they're both doing exactly the same job. Yeah, it's not to say it doesn't happen. Certainly these data confirm that it's happening. But it is an ongoing challenge for us to continue to face and to have to deal with, being sure that there is no pay gap in gender differences. If a woman is doing the same job that a man is, the woman should be paid at the same level that a man has. Anyway. Logistical problems pose barriers to healthcare. You know, and part of it is finding a doctor that will accept your insurance. Part of it is when doctors' offices are open, they typically are open the same time that many people have to work. And so, you know, people have trouble getting off of work to go to the doctor's office, or childcare or transportation. You know, all of these things can be substantial contributors to people who need healthcare but aren't able to have access to healthcare. Again, primarily because of you know, their financial disposition. And there are certainly other cost barriers. Being uninsured is probably the most significant one. I will say with the Affordable Care Act, we've substantially reduced the number of people uninsured. At the time the Affordable Care Act was passed, we were over 60 million people out of a population of 335 million at that time. Today, we're at about 24 million. So we've dramatically reduced it. But we haven't reduced it as much as we need to. We need to continue to drive this down as close to zero as possible. It is an essential change that we need to make, again, in terms of national policy and national strategy. When people have health insurance, they're far more likely to seek preventative services, and by using preventative services, avoid costly disease and conditions that easily pop up when people are uninsured and therefore don't seek routine clinical services in a timely way. Birth and death rates, again, deaths per 1,000 live births, infant mortality is much lower in many of the European countries than it is here in the United States. And again, that's a reflection particularly of rural healthcare. Birth rate, live birth rate or deaths per 1,000 live births here in New Orleans is actually quite low, but for our state is quite high. And again, it just reminds you of the fact that if you live close to lots of good healthcare, you have access to the things that you need. When you don't have access, we have to develop strategies and programs for helping people gain access in some of those areas. Maternity mortality, again, continues to be an ongoing problem here in the United States. And again, it reflects the fact that if you live in an urban area and you have healthcare coverage, you're far more likely to seek the care you need in a timely way. And so, but what that also means is if you don't live in an urban area, you're far less likely to have good access to quality care, and you're far more likely to not have insurance or some type of form of coverage for the type of services you need. Let's kind of pivot to a couple of words, acute and chronic. When we talk about acute illness or injury, we're talking about something sudden, such as a heart attack or a stroke. A chronic condition is a long-term problem, typically associated with either poor health or a lack of wellness. but it can be something else like cancer, some type of chronic condition in the aftermath of an acute condition. In other words, if I had a heart attack, that's an acute condition. If I damaged my heart substantially in my heart attack, I'm most likely to develop a long-term condition called congestive heart failure, which means I've developed a chronic condition following my acute condition. Again, acute injury from a fall, acute injury from a vehicle collision, a heart attack or a stroke. A heart attack is damage to your heart. A stroke is damage to your brain. Leading causes of death in the United States. Now, this is prior to COVID-19, but heart disease, cancer, and lower respiratory disease. And the lower respiratory disease is typically associated with environmental conditions. Most of the people with chronic lower respiratory disease either worked in a coal mine, smoked cigarettes, or worked in a factory that produced linen or produced cotton. It's called black lung, associated with coal mines, brown lung associated with working in a fabric type mill. And then smoking is actually more prevalent of a contributing factor to cause of death and respiratory disease than anything else. Smoking is also a higher contributing factor to cancer than anything else. Smoking is also one of the leading contributors to heart disease. So again, if I hadn't mentioned it before, if you're not smoking, please don't start. And if you have started smoking, please stop. Accidents, unintentional injury, diabetes, and kidney disease, again, remind you of what our leading causes of death are and how many of them are acute medical conditions. Let's go ahead and talk about chronic health conditions. About half of all adults have some type of chronic health condition, at least one chronic health condition. I'm reasonably healthy and I don't have one of those chronic health conditions, but I know many people who do. And so it's certainly important to, on an annual basis, I go to see the doctor and they draw my blood test and my lab works and do an analysis to be sure that I'm healthy. And but they're constantly looking for things to be sure that I'm okay, and if I'm not okay, to take care of. But again, it's that constant monitoring that needs to go on to be sure that if you have any type of chronic health condition, that it can be treated and effectively managed. This is emphysema, certainly a chronic condition. Again, primarily we associate with smoking cigarettes. There are other things that contribute to emphysema, but the leading contributing factor to emphysema is smoking. On your left is a set of healthy lungs. On your right is a set of lungs that have been exposed to emphysema. This is a patient that has emphysema. They have that chronic barrel-chested look. It comes from being in respiratory distress for a long period of time. Again, once you destroy tissue in your lungs, it doesn't grow back. And so this is a chronic condition that eventually will lead to death. Obesity is certainly a problem in the United States, and then all of the things that obesity contributes to, whether it's diabetes or hypertension. But there are a number of things that obesity does contribute to that that does lead to other health challenges as well. Stroke, a lot of effort has been made to, again, recognize stroke and then immediately develop strategies to help correct the effects of stroke. Diabetes and control diabetes, and then the effect that diabetes has on the rest of your body can be substantial. And yet, 35 million Americans have some form of diabetes. And so again, it's very important for us to identify what are things that can be affected by some type of diabetic condition. Most of our diabetics today in America, if they have type 1 diabetes, they'll use an insulin pump. Type 2 diabetes we typically associate with people who are overweight. Not always, but type 2 diabetes is typically a reflection of the pancreas not being able to keep up with how many calories are being consumed. And that overworking of the pancreas for an extended period of time can certainly lead to a long-term problem associated with it. Again, chronic care in terms of diabetic care, this is an insulin pump with an indwelling catheter. On the right is a continuous glucose monitoring device. The continuous glucose monitoring device is constantly sending information to the pump to tell the pump when to secrete insulin. It's basically an artificial pancreas. The pancreas is not the brightest organ in the body, and so it's pretty easy for us to mimic it. The best solution, though, is to continue the research necessary to try and cure diabetes. This is kidney failure and kidney disease. People who have kidney failure and wind up on dialysis, this is what dialysis looks like. So every 2 to 3 days, you go into one of these dialysis centers, and all of the blood in your body is filtered through this dialysis machine. The aim is to filter out the impurities. That's what your kidneys normally do. But if your kidneys have failed, you'll be on dialysis for the rest of your life or until you get a kidney transplant. Just another picture of a dialysis center. Congestive heart failure versus a normal heart. After a heart attack, you can develop congestive heart failure. The heart gets larger just to make up for the lost pumping capacity that a normal heart has. The signs and symptoms we see associated with congestive heart failure is this, the ankle swell or the lower leg swell, and the indentations, that's called pitting pedal edema. We spend 86% of our cost in healthcare going to treating chronic disease. And so another part of this is understanding social determinants of health. What are the social factors, the individual behavioral factors, and what are the genetic predispositions that we have that contribute to healthcare? Healthcare spending by the numbers in terms of chronic conditions. Again, how many people have at least one chronic condition, and then how many people have multiple chronic conditions. Typically, when you have one, you're more likely to have more than one because some of the contributing factors contribute to more than one chronic condition. Population growth in terms of projections for people with multiple conditions that are chronic. Again, we continue to see this. The escalation, though, is more likely tied to the age of the patient and the aging of our patient population. It's also important to know what a risk behavior is. Smoking is primarily the biggest culprit in this, but poor food choices, excessive alcohol consumption, never exercising. There are things that happen that make it difficult for us to live a healthy lifestyle if we're making poor choices of risk behaviors that we have. Again, tobacco use, unhealthy diets, physical inactivity, and harmful use of alcohol are 4 of the most common contributing factors to disease, both in the United States and around the world. more than half of adults don't meet the type of physical activity they need to meet each day here in the United States. More than a third are considered obese. We have a substantial problem associated with eating excessive calories, particularly those that are not nutritious. Let me go to here. Again, smoking continues to be a challenge. And then binge drinking or excessive alcohol consumption, again, continues to be a challenge. Bottom line, if we eliminate many of these risk factors, we're going to eliminate most of our heart disease, most of our type 2 diabetes, and 40% of cancers would be prevented. And then diabetes, cigarette smoking, high blood pressure, high total blood cholesterol. Compared Louisiana to the rest of the United States, we typically don't do as well as it relates to healthy consumables compared to healthy choices that we make. And so that takes us to the end of our presentation for today, but it is important to know the relationship the environment has on what we do with our bodies, what we put into our bodies, and how that either makes us healthy or keeps us sick. And it's certainly important for us to understand the role that health plays in our long-term life expectancy, the quality of life that we have, the choices that we make as it relates to the things we put in our body, the air that we breathe, the water that we drink, the food that we eat. All of those things play a big role in the long-term health of our population. That's certainly the model here in America. That's certainly the challenges we face here in America. I'm not sure how many of those challenges you face there in China, but those are certainly the challenges we face here. Again, I get back to our 5 things for today. Americans do have great access to healthcare. We just don't always choose wisely, and the great healthcare we have access to is far more likely to be associated with emergent care, things I call heroic medicine. We do that well, probably as well as anyone in the world, but that's also an expensive way to do things. If you wait until something is bad before you do something, it's typically going to be a lot more costly. We have expensive healthcare, and understand the difference between a holistic model, a wellness model, and a medical model. Of the 3, the most expensive is the medical model. Sadly, of the 3, the most expensive is the one we have here in the United States. But understand the role a holistic model plays in developing and maintaining a healthy lifestyle, and a wellness model. Either of those are good choices. Both of those are certainly things to personally embrace. And with that, I'll get to questions. Do you have any questions today? I don't, your mic is muted. Yes.
Okay. Yes, you can hear me? Hello.
Yes. Hello.
Oh, okay. So I would like to hear the lecture about healthcare and the basic knowledge. Yes. In terms of the concept of the health, the medical model, the holistic model, and the wellness or sustainability model. So I want to ask you the first question. And do you think is there developed sequences?
So, so what I understood was in terms of healthcare and in terms of how we take personal responsibility for our own health, and then how that contributes to chronic conditions. Here in America, the biggest challenge we have with healthcare is because we rely on the medical model more than we do with the wellness model or the holistic model. We don't do a good job of taking care of our health. We don't do a good job of taking control of our health. We wait until something is wrong before we do something about it, and that has a high cost associated with it. Really the most important thing I think we can take from this today is there are things that determine our long-term health that certainly reflect on choices that we make. Being sure that we make healthy choices, the food that we eat, the water that we drink, being sure that we go to the doctor for routine checkups, being sure that we take vaccines. There are a lot of choices that we make that have long-term effects on our health. And so I would say the biggest challenge we have in the American model of healthcare is we don't always choose wisely. We tend to put things off. We tend to ignore things until we're sick. And then when we're sick, well, we spend whatever we need to spend to get healthy again. And that's a costly way to do it. It really erodes how much value that we have in the system just because of how much money we spend on people who are sick, as opposed to you spend far more money when someone is sick than helping someone stay healthy. We just don't always choose to want to stay healthy, or at least do the things we need to do to stay healthy.
Americans spend many money to the healthcare. Maybe take the 20% GDP. In China, it may be now 7% of GDP. So I want to know, so many money use the healthcare. Maybe it's very competitive to America. How do you think about the result in America?
Well, so China and the US both have the largest GDP, the largest economies in the world. And so I think the main thing that you can learn from this without spending as much money as we spend is what are places that you can, because healthcare is investment. It's investment in the population of your country. And we don't do, at least the American version of healthcare, we don't do a good job of investing in helping people stay well. We spend money after people are sick. And so that's why we spend so much of our GDP on healthcare. I do feel like that money could be spent better. We could spend the same amount of money in healthcare and have a much healthier population if we invested it in the population before they got sick. The American economy and the Chinese economy are certainly, the two largest economies in the world by far and away. No one else compares to China or the United States. And so because we have such large economies, we do have a lot of options. And And it's good to have options because that's the best way to serve your population. I think the main thing that I would want to take away from what the Americans do is some of the things that we don't do. We don't invest in keeping our people as healthy as we should, and we spend too much money after people get sick. And if we spent more on keeping people healthy, in theory, we should then spend less on them when they're sick because they're not as likely to get sick. But anyway, that's at least the American version of that.
You spend so money, every country, not like American. Okay, and the three questions, why is American healthcare system unique? Why?
I didn't understand the last two parts of that.
I want to know why is American healthcare system unique? Unique.
I'm sorry that my volume is a little bit distorted and I'm not able to understand those last two words.
Why is the American health system unique? Unique. Yeah.
Sure.
Yeah.
Unique. I think the unique the unique characteristic of the American healthcare system is again our focus on really critical injury or illness. When someone if someone needs a liver transplant, the hospital in New Orleans, Ochsner, is one of the best in the world. If someone needs a heart transplant, we have several hospitals that are some of the best in the world. But those are very expensive procedures. And so the unique things about the American model of healthcare is we do some really elaborate cutting edge things, but they're also costly. And I get back to the earlier point of the thing that we should do that we don't do is focusing on prevention and wellness. I do think it's unique in how we again, heroic medicine, if you have an injury from a vehicle accident, those traumatic injuries, if you have a stroke, if you have a heart attack, we have some of the best care in the world for those types of those sudden, emergent, urgent, acute conditions. But those are also expensive things. And so if we can go back to the root cause, what caused those things to occur, and look for ways to avoid them, then we potentially could save a lot of money that we currently spend. Again, from a heroic medicine standpoint, we do those things really well, but those things are expensive. And so it gets back to the prevention piece. If we can prevent disease or reduce the likelihood of disease, prevent vehicle accidents, reduce the severity of vehicle accidents. Maybe it's slowing down, maybe it's wearing a seatbelt. What are things that we can do to avoid those things? The really unique characteristic of the American healthcare system is how much we focus on those really acute, sudden, emergent conditions. And as I say, we do that really well, but those are some of the most expensive things that we do. So I would rather we not do them as well if we didn't have to do them as often, but we do them very often, and therefore we're really good at it. It costs a lot of money to do it that way.
Thank you very much. Teacher, we have 3 questions. The first one is a person who often has risky behaviors will not get sick at ordinary times. Does it mean that there is no need for risk management?
I'm having trouble with the microphone. I'm sorry, it's the distortion of the. Can you type the question, or can you type a couple of words of the question? And I can pick out the rest of it in the chat. That's a good question. So, you know, so your question, a person who often has risky behavior will not get risk at ordinary times, and that is correct. Does it mean that there's no need for health management? You know, there is a need, and a part of health management is also advocating for people not choosing risky behaviors. You know, that's more of a public health approach than it is a health management approach, but we all have a stake in that. And so it's important for us to promote healthy living and healthy lifestyles. when people choose risky behaviors, again, that can be a very expensive way for us to provide healthcare. We're still going to provide it, but again, as health managers, as healthcare leaders, our role is to promote wellness and to help people stay healthy. It's also to provide emergency care whenever it's needed, but help people make healthy choices to prevent the need for chronic care and certainly emergency care, and certainly because of risky behaviors.
Thank you very much.
Okay.
Okay. See you tomorrow. See you tomorrow. See you tomorrow.
Okay. Bye-bye, everyone. I will see you tomorrow.